Behind every athlete is a story of perseverance and often those who make it possible. So when Wendy Stackhouse, sorry, let's do this again, my bad. 3, 2. Behind every athlete is a story of perseverance and often those who help make it possible. When Wendy Stacken's son Nick was born, doctors warned he would face significant health challenges and an uncertain future. Today, at 31, Nick's lifelong participation in the Special Olympics reflects determination, commitment, and optimism as Special Olympics athletes compete throughout the summer. His journey shows the impact of dedicated care and strong family support. Joining us are Wendy Stacken and Lucille Aceta of CVS Health to discuss caregiving, resilience, and helping individuals with complex medical conditions thrive. Ladies, welcome. Thank you so very much for your time. Wendy, let's start with you. Your family's journey began with a diagnosis no parent expects to hear. So take us back to that moment and what helped you navigate the uncertainty and become an advocate for Nick.
Great question. Nick had a very tough birth, and by 13 months old, he was diagnosed with a primary immune deficiency. It was frightening, it was scary, but we did have home care nurses coming in that were able to support us and explain what was happening. We had many doctors tell us Nick would not make it till 2 years old. And one of his very first infectious disease docs did say, do you want him to live or do you want him to just survive? And that changed our way of thinking. It was just kind of like, yeah, we want him to live. We want him to be able to do all the things he can do. So that's driven us quite a bit.
Yeah, I have an 18-month-old daughter at home, and I can't even, when you're talking about that, it makes my heart drop. And so I feel for you. I'm so glad that Nick is thriving. So Lucille, families facing complex medical conditions often feel overwhelmed, right? So what advice do you have for families experiencing medical challenges like this?
Well, definitely they are overwhelmed, and some even feel isolated. So it's really important to know that there's a lot of resources out there. One is really ask a lot of questions. Most important as well is to build a very trusted medical care team. Obviously the doctor, the nurse, we have an infusion nurse, a pharmacist. You know, I would also suggest advisory and advocacy groups that are out there that can support. There's a lot of support groups that are out there as well that can help with resources on the diagnosis, the journey. And I would say Nick is on a very critical medication called IG. And that medication itself, rated, studies have shown that hospitalizations are reduced by 50% when on it. So being on the right therapy and having the right support around that therapy is critical. And in this case, you know, he has Jackie, a nurse that he's known for quite a while, that's been administering the therapy with him. And being part of a care team is really like the most critical component of supporting the family and the patient through the journey of diagnosis. And looking at Nick now, he's 30 years later on the therapy, as well as being supported by a care team of pharmacists and nurses alongside Mom Wendy here.
Well, Wendy, you've watched Nick overcome challenges and succeed as an athlete for more than 2 decades. That is so impressive. So what has that journey meant to your family, and what message do you hope other families take from his story?
You know, if your child is eligible for it, get them involved in Special Olympics, because not only will your child make friends and feel included and feel accepted, you will meet other parents who are going through similar things and you won't feel so alone. It's really important, and it gets a lot of these athletes get a place to exercise, a place to work out, and that's so important.
Lucille, can you touch on the critical role that specialty care teams play in the patient experience, and how can they help simplify care and empower patients and caregivers along the way?
Yes, you know, a specialty pharmacy is very different than what you typically see in your neighborhood or community pharmacy. Specialty pharmacies have really unique therapies that they handle and care for patients with complicated, complex conditions such as cancer, hemophilia, immunocompromised conditions, as well as pulmonary arterial hypertension. These are many therapies that you typically don't see in a community pharmacy. And the dispensing of these is very critical, right? Knowing how to dispense the proper storage, et cetera, on these therapies, and then wrapping unique resources around the therapy with 24/7 access to pharmacists and nurses, the ability to have training programs, information that support them throughout the diagnosis as well as their ongoing journey. And you see that with Nick, right, with his nurse Jackie and supporting Wendy as a caregiver. That is really the goal of having a pharmacy that is supporting the entire care team model.
Wendy and Lucille, thank you so very much for your time today. Before I let you go, though, where do we go to learn some more information?
CVShealth.com.
CVShealth.com. Easy enough. Thank you so very much for your time. Folks at home, if you want to catch this segment again or others like it, just head over to First Coast News Plus.